FAVMI presents Unfolding Mental Illness, hosted by Saraswati Suresh.
Hello everyone. FAVMI Foundation, Family's Voice of Mental Illness, and the Mumbai chapter of FACE is back with our podcast episode of Unfolding Mental Illness. I am Saraswati Suresh, founder of FAVMI, and I have my co-host Dr. Sachin Gunurkar with me.
Hello.
Today our guest is a very well-known psychiatrist of India, and our topic today is A Psychiatrist's Guide to Family Caregivers. Dr. Vidyadhar Watve is a practicing psychiatrist in Pune Hospital since 1976. That's about 47 years. And he has attended to more than 1 lakh patients. And that's his experience, what he's going to be sharing with us. Besides this, his hobbies are theatre. He has traveled wide a play called Gashiram Kotwal, which is a milestone in Indian theatre. It's our absolute privilege, sir, to have you with us today as our guest. And we are very thankful for giving us your time today. Yeah? So the first question which I'd like to ask you is that since you've been practicing in this for nearly 47 years, what is your take that how things have evolved in the mental illness space in terms of medicines, patients, family, etc. in the last so many years?
Okay. Basically, there was almost negligible awareness about mental illness 30-40 years ago. There was a stigma attached to this illness. People will proudly say that XYZ is my diabetologist, ABC is my cardiologist, but nobody will say that XYZ is my psychiatrist, because stigma was attached to this illness.
So true.
This problem of stigma is world over. Therefore, WHO has come up, live with in the society without stigma. Remove stigma was slogan that WHO had given. So stigma is gradually decreasing. A program like this will give whatever I say about mental illness to another 150, 2,000 or 100,000 or whatever. Wherever you are doing this broadcast, it will be, or wherever it's shown, people will know that this is like any medical illness.
Absolutely.
I honestly say this is a medical illness, just like in diabetes.
Correct.
You have got lack of insulin, that's why sugar increases. We call it diabetes. When you give insulin or tablet, the sugar comes down.
Absolutely.
And diabetes is under control, not cured.
Correct.
Similarly, in major psychiatric disorder, almost all, it's a chemical change which brings about change in thought, which leads to change in emotion, and which leads to change in behavior. Thought is a chemical process you cannot see. Emotion you can see. The patient is angry, is having panic, is anxious, or is having violent emotion in his face.
Yeah.
This you can see. But a behavior, if he's afraid of anything, he will run away. And if he's in a mood to fight, he will start fighting with someone. So, thought is a chemical process you cannot see. Emotion you can see. Angry or timid and ran away. Behavior you can definitely see. So, to bring about change in this, you give another chemical called medicine,
Correct.
which brings that level of chemical back to normal.
And
You cannot see because it's chemical again.
Correct.
You can see this XYZ is behaving normally now.
Yeah.
He's friendly with so many people. So change in behavior brings you to the doctor. Change in behavior for good, you say thank you to the doctor. This is the way in which I would like people to understand. This is no stigma related to this. This is like any other medical illness. Like one has got COVID, somebody has got typhoid, somebody has jaundice. Similarly, he has got a schizophrenia, mania or depression or whatever. So this change is one of the very important things that will spread awareness in the patient, and automatically patients will come. You will be surprised to know that faith healers send us patients. Okay, faith healers say now this is beyond God and me, you have to go to doctor, whatever, any XYZ. So it's a good sign. People are having the knowledge that this much is possible and this much is not possible, which has to be tackled by psychiatrists with medication. As far as medications are there, there's a lot of change. First medicine came into market in 1952.
Okay.
Sir Winston Churchill, Prime Minister of England, who won Second World War in 1944, was himself suffering from bipolar disorder.
Oh.
He was having mood changes, highs and low. When Sir Winston Churchill was in high, he did Normandy attack. He won the war for Second World War for the world, and when he used to be low, he used to lock himself in a war room, smoke 24/7 cigar, famous Churchill with a felt hat, and he used to drink alcohol day in and day out. That state, Sir Winston Churchill himself has called as a black dog state. That's why a whiskey called Black Dog is most famous and costly in the world. It is available. So if Sir Winston Churchill can suffer from this, why not you?
Exactly.
Guru Datta, suffering from depression, committed suicide. Marilyn Monroe committed suicide. Bayuji Maharaj committed suicide. So depression is extremely common. Again, it's a medical illness.
Yes.
Proper treatment and timely treatment is most important. Now, medicines, 1952 first antidepressant came when Churchill Sahib was already recovered. And I would request you to tell your audience to see a film called Churchill, which is available on Netflix, and the actor was nominated for Oscar. He did not won, but it's an excellent film. All things, cheroot, smoking, everything is shown in that film. So that's part. The point is, all this helps us to spread the awareness. Medicines have made a lot of changes. There are tremendous advances. The 1 drug, 2 drug, 3 drug were available way back in 52. Now we've got a host of medications. Plenty. If one is not able to work, you have got 2. You have got, that is not working, 3, 4,
Lots
5,
of
6.
alternatives.
So many options. And along with medication, it's the other treatments, psychosocial treatments are equally important. It's only prescription. No. You come here, you tell me, I write a prescription, you go, no. Along with that, there is a definite role for psychotherapy, which is done by psychologists. I also know what is psychotherapy, but then the best person trained is a psychologist. We have a role of psychiatric social worker because they all help the patient in other ways, like where to keep him, what will be the place where he can be safely kept for say period of 2 months or 3 months. There are rehabilitation centers. These are all the advances. In addition to medication, we have got so many newer techniques. We have got so many newer medicines to help depression, to help schizophrenia, to help bipolar disorder and whatnot. There are so many mood stabilizers available. So the immense advances as far as medication is concerned, immense advances as far as awareness is concerned. All this should be should go to the people, and whenever there is any social gathering, they should start discussing. Because all females, when they are in a Bishi party, they will say, oh, this is because of the menopause. No, this is because of no. Menopause is a process which starts from 45 and still 55, 57. It's a 10 years period. Actual stoppage of menses is menopause. But people attribute everything that emotionally happens to the lady, this is menopausal. No.
All hormonal changes.
So, very definitely there is a illness called depression which can come not related to menopause, independent of menopause, which should be treated enthusiastically with antidepressant and if need be electroconvulsive treatment. About electroconvulsive treatment, lot of misconception.
I mean, that was going to be my next question.
Please go ahead. What is the question?
The next question is ECT.
Yeah.
You know, all of us have this image of ECT thanks to Bollywood movies the way they give the electric shock and, the way it is portrayed, basically.
Yeah.
It's very scary, and I don't know, it sounds very traumatic, to everybody.
Yeah.
So I really wonder, is it that how it works? Should family carers even think about it for their patients? What's your take on that?
ECT is one of the most effective treatment on earth available for psychiatric disorders.
Okay.
It's electroconvulsive treatment. You give anesthesia, you give muscle relaxant, and you put the current, and this much is the movement. Hundreds and thousands of the people get convulsions on the road. What happens? Sometimes they lose the tooth or termite. Nothing more than you. Here you are doing it. I do almost 40, 50 every day. Every day. So more than 2 lakhs I have installed in ECT. And you have to take proper precautions. The anesthetist is available. Anything happens. You see, people are afraid of doing this because they are working as a single person. So something goes wrong, he is the person who has to fight. I do it here in a team. Anything happens, I can take the patient to the ICU in 30 seconds. Sometimes mishap can happen. That is because of anesthesia also it can occur. But it's one of the safest treatment. Okay. See, basically in 1938, Sidney and Benny, the French psychiatrists, they observed that people who are having epilepsy, proper convulsion, when they are emotionally tense, they omit the drugs for 2 days and get convulsion. And they used to feel relaxed. So these people thought the epileptic patient, or I should not say epileptic, patients with epilepsy can take care of the emotional turmoil by omitting the drug and getting to convulsions. Why not do it reverse? People who are emotionally disturbed, why not give them induced convulsion and see? And that's how it started way back in 38.
Okay.
So those machines were there, little crude. Now everything is absolutely sophisticated. In our country, our medicine works on the doctor-patient relationship. Vishwas pe chalta hai. In America, they want everything. They feel that every patient is a potential litigator. So they tell the patient, yes, this is the treatment, you can die, you can have this, that, who will sign? And they want patient to sign. In our country, we do maximum efforts to take signature from the patient, but if not, we can take relative signature. Because our medicine on the doctor-patient Vishwas pe hai. We don't feel, the patient who has come here, brought by the relative, he doesn't have insight, he doesn't know that I need ECT. If the relatives who come here prepared, we explain to them, this is definitely informed consent. We explain everything, patient can die also, but they sign it willingly because such accidents occur absolutely rare. And I have so far not faced anything.
But is there loss of memory because of
very
ECT?
good question. Everybody feels this. There is a loss of memory. That occurs for a day or two.
Okay.
Patient after ECT, after convulsion, epileptic or patient with epilepsy gets a convulsion. He loses memory for 2 days. He's restless. He's violent. Maybe unlucky patient can get violent after electroconvulsive treatment. Not only, but that with proper epileptic attack, they can convulse. They can get violent, but that is called as post-ictal confusion, which is treatable. 6-8-10 घंटे में ठीक हो जाता है, उसमें क्या बड़ी बात? You can give injectable to cool him down. But this is not a routine thing. Normally, it's an uneventful process. The problem is whether you have to admit the patient. No, it's an OPD procedure.
Okay.
But commercialization in every field has come. So in metros they'll say you have to get admitted to 1, 2, 3, 400 investigation, and they make the patient pay 30,000-40,000. Here we do it for 1,500 rupees. In Sassoon it's free. Every patient is given ECT under anesthesia and muscle relaxation. Nobody gets fractures or anything. But occasionally you can get loss of teeth or tongue. Nothing more than that. It's one of the safest and most effective treatment till date. There are many things which have come to replace, like RTMS. But everything is next to
Easy.
ECT is the best treatment. Only thing is that confusion remains for a year. If the memory loss is never permanent, it may remain for 1 or 2 days. So if I post the patient for ECT, he's having memory lapse, I will not give second ECT day after tomorrow. I will have to third. What's there? It's all reversible. There is no medicine, no vitamin B12 required, no paracetamol required for that patient for the memory. It's a 100% temporary phenomenon. The image of this treatment, especially in media, especially in Bollywood films, even Hollywood I'm going to mention, one flew over Cuckoo's nest. The Oscar-winning performance in which they have shown a straight ECD, putting the gag and all this thing. That time it was the only thing available.
Correct.
But that created a big row in American psychiatry. They hated the film. They said, "Why, it may be excellent film, but it's against the..."
It gives a wrong image.
Completely wrong image. Seeing that, people come and tell us, "Waisa to nahi hai."
Correct.
It's not so. And another great film called Naam.
Yes, of Salman Khan.
Salman Khan. With this bite, he runs around and Amrish Puri follows him. It never happened. It's foolish. It's tarnishing the image and completely हमारा नाम खराब कर दिया. But here I say, I show them, this is what I am going to do to your brother, sister, whatever. I call it as a 5-star hotel में जो चपाती बनाते हैं. I say this is a आप सामने आके देखो कैसा जमाता है चपाती और ये उस तरह दिखाओ. See, convince yourself and then you will give it. Easily accept. That's why I get consent ready. I said हुश आप बाहर ठहरे बिल्कुल आप देखो ना क्या है. Transparent हो गए. इसलिए I can afford to take 30-40 patients a day, convincing them. Nowadays, the so-called Google or net-savvy people are more problematic about this rather than a villager. We can say, "Shock ka laya hu saab, de do shock." They will willingly come because they know the result. Patients come sometimes alone and say, "I am alone, I want ECD, I will go back on not on a 2-user something." So that is the effective treatment which people are not using because of the media and the picture portrayed. It's one of the saddest. Anything else on ECD?
What is modified ECD? What do you call as modified ECD?
Modified ECD, you say, madam, generally in mental hospital, when I was working, a conscious patient lies, don't you put it, I can give conscious patient.
Okay.
So 1997, Supreme Court has said, don't give direct ECD. Use modified ECD.
Okay.
What is modified? You give anesthesia, you give muscle relaxer. So instead of that,
this much. Okay.
But Indian Psychiatric Society, there is a great obstacle in practice of psychiatry today. Is Mental Health Care Act of 2017. And against that, we have moved Bombay High Court. Modified ECT, they say this law, modified ECT should be given, but we claim there are places where anesthetic is not available, where risk of anesthesia is more than risk of ECT. So allow us to give state ECT. That PI is pending in Bombay High Court. We are fighting tooth and nail to see that there are a couple of amendments. This so-called Mental Health Act of 2017 is more problematic in practice. There they say that you need consent only from the patient. Nobody will give. They said in emergency you cannot give ECT. Our argument is it's an emergency where you have to give ECT. A patient comes to me with a suicidal intention. This law doesn't allow us to give ECT for 72 hours. So till that time, those 72 hours, the patient will commit suicide. We have moved this High Court against this law, and we are waiting for our certain amendments. The government has finally agreed to accept some of the amendments, especially about ECT. So we shall
wait for the judgment.
It's one of the seconds. The message should go that if your doctor says, ECT to be given, give it.
Give it.
Cost-wise, it depends on
The place where you're.
metro.
Yeah.
The relative will say, sir, I have read that this is the OPD procedure. I will offer to give my patient an OPD care rather than indoor care. The doctor will be angry, but don't worry.
Sachin.
Yeah, thank you, sir. It was a very interesting conversation till now. I just want to understand, how do you manage lack of insight and how do you manage medicine compliance in families with loved ones who are living with mental illness? How do you actually address these two factors, and what kind of help families can take from psychiatrists and psychotherapists?
Dr. Vidyadhar, I think lack of insight is extremely important. Suppose tomorrow you tell me, Dr. Watve, you are a great doctor, but right now you are having jaundice, you better go home and lie down for 6 weeks. I accept that, because I accept that even I can have jaundice or I can have hepatitis or whatever. Having knowledge of the illness is called insight. Okay, and which is very common in medical illness. People accept that I can have this, that, or anything. Lack of insight itself is a sign of psychiatric disorder. The patient of schizophrenia lacks insight. He doesn't say the voices that I think are real. Who are you to tell me that they are not real? So there is no point in arguing whether you hear voices are real or not real.
Correct.
So you have to diagnose that this patient is lacking insight. So lack of insight also will lead to lack of judgment.
Correct.
I do some funny act because my judgment is impaired. A manic patient in a manic phase will write 2 lakhs to this, 4 lakhs to them. It's lacking judgment. A normal patient will not start distributing checks with 10 lakhs, 5 lakhs donations, whatever. So lack of insight itself is a sign of disease. The ultimate aim of the treatment is to see the patient starts gradually gaining insight. So that's the aim of the treatment, and successful treatment ultimately will make the patient accept that yes, this was the problem, now I am much better. Coming to medical compliance, medicine compliance. In fact, in all branches of medicine, compliance is the issue. You may take cardiac, you may take oncology, everywhere. Patients get tired. 2 tablets in the morning, 1 in the afternoon, 3 at night. No. If you and me are having antibiotic 1 days, you forget 1 tablet.
Correct.
These aside other patients. And in psychiatry, 70% of the patients are poorly compliant. Most of the cause of relapse, most of the cases, cause of the relapse is giving medicines or omitting medicines. So compliance you have to assure. Tell the relatives that this is likely to be, he is likely to be missing the medicine. So simple dosing. So as a psychiatrist, I would like to tell all the relatives to request their psychiatrist to make the prescription user-friendly. In the sense that you give 1 tablet in the morning, 1 at night. Then it is possible.
Correct.
So if you give 1 in the morning, half in the afternoon, 3/4 in the no. Make it simple and don't write 1.5, 2.5. No. Simple 1, 1, 1. Or in Parkinson's disease, you cannot do this. You have to give it Syndopa every 4 hours or whatever. But in psychiatry especially, you can make the dosing schedule very simple. You have got boxes available.
Yes.
Morning dose, afternoon dose, evening dose. And the relative should see that this dose is given 3 times or 4 times, whatever. If the compliance is maintained, lots of relapses will be less. Only time when you are definitely allowed to omit medicine is first trimester of pregnancy. So I write down, you are a female, you have every right to have marriage, you have every right to have a child, but please omit all medicines if your UPT is possible. And from 3rd, 4th month onwards, you can start medicines which are available. See, I always argue that so-called effect of that small 1 milligram tablet on fetus and his brain, mother's mental health is as much important as so-called side effect.
Correct.
So take the tablet, and it's most of the, unfortunately, गायनेकोलॉजिस्ट ऑप्शन प्रेगनेंसी है, बंद करो सब दवा दिया थोड़े दिन एमटी पे करो. Not at all. These advances in sonology or sonography, you can monitor every 10 days, 15 days the growth of the fetus. And the government has also increased the weeks in which you can do termination. So, very, very safe. You can give medicines during pregnancy, preferably after 3 months. You can give anything near delivery. And again, I am telling you, one of the safest treatment of pregnancy-related psychiatric disorder is ECT. Electroconvulsive treatment with proper care is absolutely safe.
So it's safe. It's
Absolutely, we give it for pregnancy, which is 8 months. Next month she is due. I give ECT. You have to take proper precaution and tell that she may have abortion. But this is what is important.
Sorry.
So, in case needed, we go ahead and do it. So, compliance, if assured, relapses will be minimal. People will be happy, relatives will be happy. Because it's in our branch, it's only not only the patient who suffers, the entire family suffers.
Absolutely.
So, you have to think of all the
Patients
family
refuse to take the medicines. And what do you do?
Pardon?
Patients refuse to take the medicines.
Oh, that's again a question. You have got dispersible medicines available. If patient is not taking because he doesn't feel that he needs medicine, there are medicines which are dispersible. You can give. Again, ethically this is correct or not. Mental Health Act allows us or not is a different issue. But for a patient, the relative is not going to read Mental Health Act. He wants his patient to be better. So I tell them, this is against this so-called law, but you can give it for some days. And luckily, long-acting injections have come.
Correct.
If the patient is taken to the doctor once in 15 days or 20 months, one injection here keeps the medicine in his body for 1 month or 20 days. So long-acting, LAI, long-acting injection is a blessing, absolute blessing for people who are likely to be non-compliant.
Okay, that's very interesting. So these kind of things are really helpful. It's all the involvement in the medical psychiatric world. Yeah.
Just how, in the sense, what kind of education should families take when they take medicines from a psychiatrist and a psychotherapist? Is there something different they have to follow, like what they do with diabetes, etc.? Or it's the same way you take your medicines? Is there some precautions or lab tests you have to do? That is what keeps...
Always, Dr. Gadorkar, my attitude has been, when they come inside, they should not feel that they are with somebody shrink.
Correct.
They should feel like they are with any other doctor, cardiologist or diabetologist. I make them sit comfortably.
Correct.
कोई दिक्कत नहीं है, बस बैठो, ये बात है, दवा लेना पड़ेगा. So you basically they feel confident that this doctor is there to help our client. ऐसा नहीं कि ऐसा बैठ के ये दे रहे, ये नहीं चलेगा. See, in psychiatry, you are not treating only the patient, you are treating the entire family.
Absolutely.
Especially husband-wife problems. Nobody, they should not, I tell them, इसमें एक फिरियादी और एक आरोपी नहीं है. Both of you can have some points lacking. So we try to heal them. Even family courts are made not to help divorces easily, but to continue the marriage. That's why most of the family court judges are females. Because they feel, I don't know whether you agree, they feel that they are more emotionally tuned. I agree or may not agree, that's it.
So, what do you feel the role of early treatment to be done at home versus institutional care? How important is to diagnose early, treat early, maybe treat the person at home versus institutional care? Because now people want their loved ones to be at home and taken care by the doctor.
Very correct.
And institutionalization is decreasing day by day. So, how do you actually look at it from where you have started practicing and where we are right now in the 21st century?
There are both sides, Dr. Deluca. One, all mental hospitals were Jamin Pe Dale, America, 1970. So, movement of community mental health care. And community mental health care is now here, according to law, is also expected to come out. Before that, early diagnosis and early intervention is the most important thing. If you know early interventional psychiatry, the movement started mainly in Australia, when a first degree or second degree relative of a schizophrenia patient or depression patient, the teachers used to pick them कि yes आपका भतीजा ये है या आपका अंकल का लड़का भी ये है, so they keep watch on that boy who is 4 years old,
Okay.
5 years old, and keep track. For them it is easy because the population is 140 crores, follow करना is difficult.
Correct.
But early intervention and early detection is the thing, because DUP, duration of untreated psychosis. If I have seen that my son is having problem at the age of 20, when he is hearing voices, he is shy, shut in, sitting in the room, not mixing, and then I said कि ठीक है ऐसा हो जाता है देखेंगे, और इसमें 5 साल चलेंगे.
Absolutely. Absolutely.
When he becomes violent, I go to the doctor. The doctor scolds me कि बस 5 साल आप क्या कर रहे थे? That is because more the duration of untreated psychosis, bad is the prognosis. In fact, as a doctor, he may come 10 years later. My duty is to start treatment. Don't wait कितना हो गया, कितने साल हो गया, आपके ऊपर डांटने का कोई सवाल नहीं. Treatment can be started at any age. For ECT, age is not the contraindication. You can give, I have given ECT at the age of 82. You can give ECT at the age of 11 years, 12 years, but this law doesn't have. Again, we are fighting for that. That's a different thing. So, medication, early medication. Now, again, there is a debate. Suppose a young boy of 5-6 years is showing some signs of abnormality. Then we pick them out. Half the people feel that you should start small, 0.5 milligram risperidone. But other people will say, why subject him to medication? That's where the psychologists and social workers, they work for psychotherapy, for proper follow-up, and they will avoid medication as far as possible. Up to the age of 8-9, it's better to avoid medication as far as possible. Just like in neurology, minimal cognitive impairment. If patient at the age of 60 has got more than normal forgetfulness, we call it minimum cognitive impairment. थोड़ा ज़्यादा ही भूल जाता है. So half the neurologists will start the treatment. Other neurologist group says only 20% of those people convert into Alzheimer. So why give medicine to other 80%?
Correct.
So similarly like this, just keep a watch. Just keep a watch. Don't give medication. And as far as possible, if she is a female, the problem of hormones and menstruation, all that comes. So avoid as far as possible. But the moment the lady, the boy or girl is 13, 14, you can start treatment. But again, follow-up is extremely important. And ऐसा नहीं कि आज दवा शुरू किया 5 साल ले लो without follow. Nowadays law, one good thing, they don't allow refill of prescription.
Yes.
They will always ask for fresh prescription.
Fresh prescription.
Prescription. That otherwise, people have started coming after 10 years, 20 years. सर हम 20 साल पहले आए थे ये दवा चाहिए बॉस. So all the medicines, all said and done, there are side effects.
Yeah.
Like Tata, this kind
This
of if this happens, quite often it is reversible. You have to change the medicine. There are better drugs, but most of the time it is not reversible. This goes on. So it's called this movement disorder drug induced,
Correct.
which is आमंत्रण घेऊन बोलवलेले आहेत. You are giving medicine without my knowledge for your son or daughter for last 20 years. That's not correct. So that is to be compliance and when to stop treatment or decrease the treatment. Same dose will not be required for 20 years. You have to reduce the dose to avoid the side effect, long-term side effects. The major side effects, original drugs, Syrinus, the haloperidol, etc., this was started. That's when newer drugs came. They call it atypical drug. Atypical drugs have got their own side effects, like metabolic syndrome, weight gain, hypertension, diabetes. So there is no drug without a side effect. If somebody claims that my drug has no side effects, assume it neither has an effect. So there is no medicine. Even paracetamol, I've got 150 side effects. But you don't stop taking paracetamol. I always explain to the patient, if you are crossing the road in Pune or Bombay, there's a good chance that you will be knocked down by a truck. But that doesn't mean that you should not cross the road. You have to cross it cautiously. That's a simple way in which I explain. So take the medicine cautiously. Come to us for any side effect. People feel that every time one goes and sees the doctor is going to charge 500. No. If that is done from my fraternity, it is wrong. I condemn that. People come for 2 minutes to ask something. You should not charge them. You can make them wait for 2 hours. But that's an individual. I'm not an income tax person, but that's an individual question. If you are a good human being, you are a good psychiatrist. A bad human being is less likely to be psychiatrist or psychologist. Anything else?
Yes, sir. How do you look at institutional care? When should a family decide when to treat at home, and when should you look out for an institution? And when do you get the person back from the institution? Because the struggle continues for families to look at it.
It's like dementia care. Alzheimer patient, it's said that as far as possible, he should be treated or she should be treated at home and avoid old age home. Similarly, in psychiatry, there are many centers, so-called rehab centers. There are some good, some bad, as usual in our country. As far as possible, our Indian parents, they always like their son or daughter to be treated at home. Treated at home. And there is one more brother or somebody. There is a good chance in our families. It's called as high express emotions.
Correct. Yes.
They can be positive, high express emotion or negative. What is positive? Dada usko jara pani लो. It's high positive, which is wrong. Similar to क्या यार तू क्या करेगा? Such tones, such remarks are high negative expression. They should be avoided. We should teach the family. He's one of the family members. And if things become absolutely impossible to manage him at home, you can keep the patient in a rehab center for 2 months, 3 months. Previously, in mental hospital, they used to dump the patient. There are 3,000 patients in mental hospital whose name was not known. They call it not known male. 2030, that is not known male is never been also.
No identity.
The biggest work that is done is by Dr. Watve.
Yes.
You know Dr. Watve, he has picked up wandering lunatics, 7,000, and he has made them reach their home places, 7,000 people. That's why one magazine. There are devoted people like that. All are not Watve, but at least whatever your bit you have to do to help the family. And avoid institutional care as far as possible. But if there is no choice, you can keep them. If the patient is getting violent at home, keep them in the hospital for 2 months. But in a way, patient knows this. I better behave, and I better behave, and I better take medicine. That's the message that finally passes. But again, there are good rehabs and bad rehabs. The Mental Health Care Act makes every hospital is a mental health establishment. Even in this hospital, if you are treating daily dementia, if you are treating diabetes patient because violent, that comes under the ambit of psychiatric disorder. So every hospital is a mental health establishment, and you have to take license. And all the big 5-star hospitals in Pune and Mumbai, they do not entertain psychiatric patients. It's against the law. Because getting a license is 5 minutes job. You have to just apply, get license. If they don't do it, because one psychiatric patient will give them, stays there for 10 days, will give them maximum 10,000 rupees. But in those 10 days, if you do 5 angioplasties, they will fetch them 50 lakhs. This truth that I'm saying.
I was wondering why we don't have that, and you have answered my question on that.
This is the answer, and they avoid getting the license. But I am telling you, madam, please convey to your relatives or the patient that every hospital has to accept psychiatric patient. If there is no license, there is audit now which is going on. They will visit, because it's not a schizophrenia or mania. If you are having diabetes or if you are having any other illness and your sodium is low, you will end up with convulsion and abnormal behavior. That is treated as a psychiatric disease. Alcohol withdrawal is a psychiatric disease. According to this act.
Yes.
So you should follow that.
So
they avoid for non-medical disease. They avoid for commercial. I'm boldly ready to do this.
So lastly, what would be your advice to family carers?
Please repeat the question.
To family carers who are taking care of their loved ones with mental illness, what will be your advice to them?
My advice to them is very most difficult question. See, it's very difficult to advise them. And it's very difficult to be part of that family and you are a family carer. In chronic disorders like Alzheimer's and neurology, this 30% of the people suffer from caregivers problem.
Lack of support.
Burnout होता है. Depressed 30% of the people of this chronic medically or psychiatrically patient suffer from depression. That's why there is suggestion sometimes that if I have to do my work, bank work, this work, that work, I'll request my neighbor, please look after my son for 1 month. I will pay or whatever. And they come for help. And then 1 month you can have relax and do your work. The same thing, the rehab can be used. There are old age homes, they keep the patient for 1 month or 2 months only and they do their own work for whatever next year that is pending. And my advice is to do take help of good neighbors. Luckily in our country, family is the main support. So if my family has got one patient, I request Dr. Kaur, hard din jaake aata hu main. So we do it really. I give them medicine, I give them whatever. So they do it. So advice is to take help of your neighbors. Otherwise,
burnout is sure. The burnout of the carer is sure.
At least it will be reduced.
Yes.
Thank you.
Thank you so much. You have.
Yeah, so one more question, like how what Saraswati asked. What would be advice for awareness about mental disorders in the current generation? Because now there's a lot of awareness after COVID. And what would be your message as being practicing for the last 5 decades and having so much of experience, having seen 1 lakh patients? Where should we start intervening? Like, should we intervene in school or in college, or when? So, and how do you educate families that?
See, programs need not be psychiatrists. Every school has got a school psychologist. She should do small programs and tell them this is the problem. Then there are people in colleges, head of the departments of psychology, or there are many psychiatrists who are ready to go into the college and teach them what is early intervention, what is psychiatric disorder, and information booklets. There are many, and programs like this.
Okay.
Some programs, video program is okay. Live program in Bombay, there are many psychiatrists who are ready to talk to them. Those who are aware, like Anand Nadkarni, those who are somewhat concerned about the social problems and psychiatric problems in society. I think psychoeducation of the family as well as people at large should be the mainstay. And finally, message should be, yes, this is a problem. Accept it and face it. Something like that.
Thank you so much.
Thank you so much for your time and your wonderful, inputs to all of us. I think all our families are going to be. I've learned so much today from you. Thank you so much.
If health permits, I'll come to your Bombay and give this talk.
Sure. Thank you so much.
Okay.
Thank you. Thanks.
Thank you. Thank you very much.
Yeah. Okay, sir.
Thank you for your time.
Yeah.
Yeah.